I need to tell you something that might save your life today. Right now, at this very moment, there's a good chance you are making a medication mistake that could seriously harm you. And the scariest part? You probably don't even know it. Every single year, medication errors kill more than 100,000 Americans. That's more than car accidents. More than gun violence. And here's what keeps me up at night. Most of these deaths were completely preventable. So why am I telling you this? Because today, you're going to learn the 7 most dangerous medication mistakes people make every single day. And more importantly, you're going to learn exactly how to avoid them. Let's start with mistake number 1. Taking medications with the wrong beverages. You might think this sounds harmless. Pop a pill with whatever drink is nearby. Coffee, juice, milk. What's the big deal, right? Well, here's the problem. Certain drinks can completely change how your medication works in your body. Grapefruit juice is the most notorious example. It blocks an enzyme in your intestines that normally breaks down many medications. When that enzyme is blocked, too much of the drug enters your bloodstream. This isn't just a minor issue. With some medications, grapefruit juice can increase drug levels by 300% or more. Imagine taking 3 or 4 times your prescribed dose. That's what's happening inside your body. Statins for cholesterol, blood pressure medications, even some antibiotics can become dangerous when mixed with grapefruit juice. But grapefruit isn't the only culprit. Dairy products can interfere with antibiotics like tetracycline. The calcium in milk binds to the medication and prevents your body from absorbing it properly. You're taking your medicine, but it's not actually working. Your infection keeps getting worse, and you have no idea why. Coffee and tea present their own problems. The caffeine can interact with certain asthma medications, causing dangerous increases in heart rate. And alcohol? Don't even get me started. Mixing alcohol with pain relievers can cause severe liver damage. With sedatives, it can slow your breathing to dangerous levels. So what's the solution? Water. Plain, simple water. Unless your pharmacist or doctor specifically tells you otherwise, always take your medications with a full glass of water. Not a sip. A full 8 ounces. This helps the medication dissolve properly and move through your digestive system. Now let's talk about mistake number 2. Not reading the label completely. I know. Those tiny print labels are boring. They're hard to read. You just want to take your medicine and move on with your day. But here's what you need to understand. Every single word on that label is there for a critical reason. Someone, somewhere, had a serious problem because they didn't follow those instructions. That's why the warning exists. Take the phrase "take with food" for example. This isn't a suggestion. It's a requirement. Some medications can severely irritate your stomach lining when taken on an empty stomach. We're talking about ulcers, bleeding, serious digestive damage. Other medications need food to be absorbed properly. Without it, they simply don't work. The opposite is also true. When a label says "take on an empty stomach," that matters too. Food can interfere with absorption. You might need to take the medication 1 hour before eating or 2 hours after. If you don't follow this timing, you're essentially wasting your medicine. Then there are the warnings about activities. May cause drowsiness. Do not operate heavy machinery. These aren't just covering the manufacturer's legal basis. People have died because they ignored these warnings. They drove cars, operated equipment, or made critical decisions while impaired by their medication. Here's a real example that happens all the time. Someone takes a new allergy medication in the morning. The label warns about drowsiness, but they think he'll be fine. 30 minutes into their commute, they're fighting to keep their eyes open. They drift into another lane. A split second of drowsiness causes a lifetime of consequences. Storage instructions matter too. Keep refrigerated isn't optional. Many medications lose their effectiveness or even become harmful when stored at the wrong temperature. Insulin is a perfect example. Store it too warm, and it breaks down. Use broken down insulin, and your blood sugar goes dangerously high. Mistake number 3 is crushing or splitting pills without asking first. This seems so innocent. The pill is too big to swallow. Or you only need half the dose. So you break it up. What's the harm? The harm can be severe. Many medications are designed with special coatings for specific reasons. Some have enteric coatings that protect your stomach. Crush these pills, and you remove that protection. The medication can cause serious stomach damage. Other pills have extended release formulations. They're designed to release the medication slowly over many hours. When you crush them, you get the entire dose at once. This can cause dangerous spikes in drug levels. People have overdosed this way. People have died. Some medications are simply dangerous to crush. Cancer chemotherapy drugs, for instance. When you crush these pills, you release toxic powder into the air. You breathe it in. Your family members breathe it in. You're exposing everyone to hazardous chemicals. Even splitting pills that are scored can be problematic. Unless the pill is specifically designed to be split, you might not get equal doses. One half might have 60% of the medication. The other has 40%. Your dosing becomes unpredictable. If you're having trouble swallowing pills, talk to your pharmacist. There might be a liquid version available. Or a smaller pill. Or a different medication entirely. Don't just start crushing things on your own. Mistake number 4 is stopping medications too early. This is especially common with antibiotics. You start feeling better after a few days. The infection seems gone. So you stop taking the pills. You save them for next time. This is incredibly dangerous for multiple reasons. First, that infection isn't actually gone. The bacteria are just weakened. When you stop the antibiotic early, the strongest bacteria survive. They multiply. And now they're resistant to that antibiotic. This is how we create antibiotic-resistant superbugs. Bacteria that can't be killed by normal antibiotics. Infections that used to be simple to treat become life-threatening. And it all started because someone stopped their medication 3 days early. But it's not just antibiotics. People stop blood pressure medications because they feel fine. Here's the thing. High blood pressure doesn't make you feel bad. That's why it's called the silent killer. You feel fine right up until you have a stroke or heart attack. Depression and anxiety medications are another common example. People start feeling better and think they don't need the medication anymore. But the medication is why they're feeling better. Stop it abruptly, and the symptoms come roaring back. Sometimes worse than before. Some medications are dangerous to stop suddenly. Antidepressants, anti-anxiety medications, blood pressure drugs, seizure medications. Stopping these abruptly can cause serious withdrawal symptoms. Seizures. Dangerous blood pressure spikes. Severe psychological distress. If you want to stop a medication, talk to your doctor first. They can create a safe plan to taper off gradually. Or they might explain why you need to stay on it. Either way, don't make this decision on your own. Mistake number 5 is mixing medications without checking for interactions. You take something your doctor prescribed. Then you add an over-the-counter pain reliever, maybe a supplement your friend recommended. A cold medicine from the drugstore. Each one seems harmless on its own. But here's the problem. Medications can interact with each other in dangerous ways. One drug might increase the effects of another, or decrease them, or create entirely new side effects that neither drug causes alone. Let's look at a common example. You're taking a blood thinner like warfarin. Your doctor prescribed it to prevent blood clots. Then you start taking aspirin for headaches. Both medications affect blood clotting. Together, they can cause serious bleeding. Internal bleeding that you don't notice until it's a medical emergency. Or consider this scenario. You're taking medication for depression. It's an SSRI antidepressant. Then you take an over-the-counter cold medicine that contains dextromethorphan. These two drugs together can cause serotonin syndrome, a potentially fatal condition with fever, confusion, rapid heart rate, and seizures. Herbal supplements are particularly tricky. People think natural means safe. But Street John's wort can interfere with birth control pills, antidepressants, blood thinners, and many other medications. Ginkgo biloba increases bleeding risk. Ginseng can interfere with diabetes medications. Even vitamins can cause problems. High doses of vitamin K can interfere with blood thinners. Too much vitamin E increases bleeding risk. Calcium supplements can interfere with thyroid medication and certain antibiotics. So what's the solution? Tell your doctor and pharmacist about everything you take. And I mean everything. Prescription medications, over-the-counter drugs, vitamins, supplements, herbal remedies. Even if you think it's not important. Use one pharmacy for all your prescriptions if possible. This allows the pharmacist to check for interactions automatically. They have computer systems designed to catch these problems. But they only work if all your medications are in the system. Mistake number 6 is using expired medications. You find an old bottle of pills in your medicine cabinet. The expiration date was 2 years ago. But the pills look fine. They don't smell bad. So you take them anyway. Here's what you need to know. Expiration dates aren't arbitrary. They represent the date until which the manufacturer guarantees full potency and safety. After that date, the medication starts breaking down. It becomes less effective. And in some cases, it can become harmful. Some medications just lose potency over time. Taking expired antibiotics might mean the infection doesn't clear up. Expired pain relievers might not control your pain. Expired allergy medicine might not stop your symptoms. But other medications become dangerous when they expire. Tetracycline antibiotics can break down into toxic compounds that damage your kidneys. Expired insulin loses effectiveness, leading to dangerous blood sugar levels. Expired nitroglycerin for heart conditions simply stops working when you need it most. Even if the medication doesn't become toxic, using expired drugs is risky. You think you're treating your condition, but the medication isn't working. Your condition gets worse. You delay getting proper treatment. A minor problem becomes a major one. Liquid medications are especially problematic. They can develop bacteria growth after expiration. Or the ingredients can separate and become uneven. You might get too much of the active ingredient in one dose and not enough in another. The solution is simple. Check expiration dates regularly. Go through your medicine cabinet every 6 months. Throw away anything that's expired. Yes, it feels wasteful. But it's not worth the risk. Finally, mistake number 7 is not asking questions. You leave the doctor's office with a new prescription. You pick it up from the pharmacy. You take it home and start taking it. But you never really understood what it's for or how it works. This is dangerous for so many reasons. You don't know what side effects to watch for. You don't know what symptoms mean you should call your doctor immediately. You don't know what foods or activities to avoid. You're basically taking a powerful chemical substance blind. Here's what you need to ask every single time you get a new medication. What is this medication for? How does it work? When should I take it? With food or without? What side effects should I expect? Which side effects are dangerous? What should I avoid while taking this? How long will I need to take it? What happens if I miss a dose? Don't be embarrassed to ask these questions. Your doctor and pharmacist expect them. They want you to ask. It's literally their job to answer. And if they seem rushed or annoyed, ask anyway. Your health is more important than their schedule. Write down the answers. Or better yet, ask if you can record the conversation on your phone. You're going to forget some of this information. Having it written down means you can refer back to it later. If you don't understand something, say so. Ask them to explain it differently. Use simpler words. Draw a picture. Whatever it takes for you to truly understand. There are no stupid questions when it comes to your medications. Also ask about alternatives. Is there a generic version that costs less? Is there a medication with fewer side effects? Are there non-drug options you should try first? Sometimes doctors default to the newest, most expensive option when an older, cheaper medication would work just as well. So there you have it. 7 deadly medication mistakes that could kill you. Taking medications with the wrong beverages. Not reading labels completely. Crushing or splitting pills inappropriately. Stopping medications too early. Mixing medications without checking. Using expired medications. And not asking questions. Every single one of these mistakes is completely preventable. You have the power to avoid them. Starting right now. Today. Go check your medicine cabinet. Read those labels. Make a list of questions for your next doctor visit. Your life might literally depend on it. Because medication errors are silent killers. They happen gradually. You don't realize Teresa problem until it's too late. But now you know better. Now you can protect yourself and your family. Remember, medications are powerful tools. Used correctly, they save lives and improve health. Used incorrectly, they cause harm. The difference is knowledge and attention to detail. Both of which you now have.